growing under the knife for all of her adult life. For 10 years, her bunion evolved into a massive, crisscrossing tangle of toes. Before her big trip, she elected to surgically correct the deformed mess. There's nothing like a surgery complication to get my attention. When the surgeon walked out after 3 hours in the operating room for a procedure that should have taken him 15 minutes, I knew. Have you ever put a screw into a soft, wet particle board? That's how the surgeon described Grandma Rose's bones in her foot. His attempt to anchor the correction of her bunion was derailed by her mushy bones. What should have been a common and simple procedure had now turned into 6 weeks of no weight bearing, using crutches, and a shoddy immune system. Surgery at age 72 always draws concern of an infection. Grandma Rose's toe supplied a dreamland for bugs looking for an easy meal and refuge. Because the screws could not hold her foot together, the surgeon slid several wires through her mushy bones. These wires went through her foot and anchored the toes to the cage surrounding her foot. In theory, the cage formed the immovable structure that held the wires in place until her bones started to weave back together. The flaw in this theory screamed at all of us the first time Grandma Rose bumped her cage. The pain vibrated down the wires, rattling the inside tunnels to her toe bones. In case that wasn't enough, these wires also provided a direct pathway for infections. Every surgery leaves a vulnerable entrance for infections to enter. That scalpel sliced through your best defense against invasion, your skin. A healthy young person's body will seal that opening within a few days. Age slowed down that sealing process for Grandma Rose. So did her rotten CLL immune system. So did the swelling. 6 weeks, no bumping the foot, no bearing any weight on her foot, no exposure to infections while living on the farm. Oh, and let's not forget, don't allow her CLL to get worse. Full court ketosis press, here we come again. Doc, what would you do? As that question circled inside my mind, I scolded myself for allowing her to have the surgery. Those mangled toes would not have killed her, but this mess might. As I considered all of her situation, she faced an uncomfortably high chance of amputation. Her risk for these extreme outcomes decreased if she did not get an infection, if the swelling reversed, and if her bones healed without complications. These seemed to be too much to ask for her situation. My best answer? Keto eating with half of a can of sardines every day for 6 weeks. Yep, we added sardines to Grandma Rose's daily foods. For real. Not only was this a very high source of absorbable calcium to help those mushy bones, but sardines in oil were keto. Like a trooper, Grandma Rose told herself she would learn to like sardines. With the return of these complications, Dad was willing to get back on the keto bandwagon again. He gladly ate the other half of her sardines. The weeks that followed proved to be the most teachable part of Grandma Rose's story. The landmines that riddled her path remained hidden because they never happened. There is no way she should have done as well as she did after this debacle. The level of danger in her situation pointed to disaster no matter how I approached it. With 2 decades of practicing the ability to predict medical disasters, this case was a slam dunk. At 72 years old, Grandma Rose had a toe filled with crumbled, mushy bones and an open wound with wires guiding infection into the most sterile part of the human body, and an immune system functioning so poorly she could not be trusted to defend herself against the wimpiest of invaders. Grandma Rose had 100% chance of a poor outcome. But the transformation happening at a cellular level resulted in repeated blessings. There was something much more profound happening deep inside her body since she started producing ketones. She healed completely, flawlessly, and without one single complication. Impossible. 3 months after the mushy toe surgery, just before Christmas, Grandma Rose checked off that Broadway show from her bucket list. With the help of her ketones and sardines, her toe had mended perfectly. Her CLL numbers continued to slowly rise. Her renewed discipline to pee ketones started to produce other benefits that were far less important to us, but noticeable. Grandma Rose had lost 25 pounds since going keto. It had been nearly 7 months since the start of her keto transition. She lost weight slowly, but effortlessly. Despite the growth of her decaying immune cells, her skin glowed with the radiance that matched the image I saw in her wedding photo. Her focus and memory were as sharp as before she developed cancer. Lock a 72-year-old woman up to a recliner for 6 weeks with no weight bearing, while isolated inside a rural farmhouse, and even Mary Poppins risked depression. But she did well, very well. Her mind, energy, and mood amazed me. All these little changes showed in Grandma Rose. She looked and felt and behaved like the woman I remember as a teenager. She was radiant. Chapter 16. Lessons from Dr. Bosworth, Your Keto Transition Roadmap. If ketosis, or a ketogenic diet, is so awesome, why isn't everyone on this type of diet? Answer: the transition from glucose to fat can be rough for many. In the book, I asked the reader to compare the two charts on the previous pages. As you listen to this book, I'll do my best to describe them. Both charts plot out several of the most common diets and compare them to one another. The first chart compares the percentage of carbohydrates in each diet versus the percentage of protein. The second one plots out the percentage of fats along the bottom and the carbohydrate percentages along the left. These charts and many of the others will be available on the website. Head to www.metonelife.com. That's metonelife.com. Notice the Standard American Diet, or SAD, in both charts. This diet packs 300 grams of sugar-based fuel into your body. Every single cell in your body is fueled by glucose when you eat this way. From your brain to your skin, your system uses sugar for energy. That's a lot of burning pine needles. Switch from sugar to fat, and that shift in power source can make a mighty crabby person. The paleo diet, found in both of those charts, has been used by many of my patients. This diet generally limits the carbohydrates to under 30% of the total food. Patients benefit from this lower amount of carbohydrates, but never fully arrive at the improved chemistry environment found with ketosis. If the dieter is lean, they often have lots of praise about the paleo diet. However, if they are more than a few pounds overweight, their insulin system overshoots, producing way more insulin than needed. They have been squirting extra insulin at carbs for years. Their insulin levels are high enough to lock down fat inside that layer of pudginess. Those fat cells are stuffed full and there to stay until the insulin sinks low enough. That continuously elevated insulin leaves them with cravings and a constant cycle of insulin chasing carbs. When you dramatically reduce your carbohydrate count, your body experiences a hormonal shift, with insulin leading the way. The cycle stops with the near removal of carbohydrates. Some patients eat as much as 300 or 400 grams of carbohydrates in a day when they first come to my clinic. 20 carbs per day is a massive drop for most Americans. When you stop eating carbohydrates, keto transition begins. How to transition a keto-fueled system. Making the switch involves the phases described below. Each phase involves marked changes in your blood chemistry and occurs at different times. I will outline these in each of the 5 phases. Again, the charts associated with this book are very valuable, so please check them out at the website, www.metonelife.com. Phase 1. Use sugar in blood. Burn through the sugar in your blood. Time required, 4 hours. Status: your fuel is 100% glucose during this phase. It comes from the carbs you just ate or drank. Not one section of your body runs off of ketones. Brain status: powered only by glucose. Entering phase 1 is the easiest part of this process. you simply use up the sugar that's currently in your bloodstream. Every time you eat more than a spoonful or a handful of carbs, you reset your system back to the beginning of phase 1. Phase 1 begins by processing the glucose that's already in your blood. This glucose came from the food you ate over the last 4 hours. Phase 1 is short. It ends after 4 hours unless you reset things by eating more carbs. Then it starts over. Don't do that. Go to bed 2 hours after your last carbohydrate. Before you wake up, you are through phase 1. Congratulations. Phase 2. Burn sugar stored in liver. Your liver makes glucose by emptying its stored sugar. Time, 12 plus hours. Status. Your fuel is 100% glucose, but now your carb fuel is coming from your stored sugar called glycogen. Brain, powered 100% by glucose. You burned up those circulating sugars in your bloodstream in phase 1. With no more food coming into your body through your mouth, your system will use your stored sugar. This stored sugar is called glycogen, and you keep it in your liver cells. Phase 2 fuels your body using this stored energy. How long will your storage of glycogen last? Good question. The answer depends on a couple of things: the size of your liver and the level of energy used in phase 2. Sleeping during this phase takes less energy than running for 45 minutes. Fighting cancer or infection requires more fuel than living without those issues. Mending a broken bone or repairing from surgery requires more energy than sitting at your desk writing a book or reading one. In addition, how large is your storage tank? How big is your liver? I bet you've never thought about that. Its size depends on how much stress you've put on it in recent years. Your liver constantly grows new cells to meet your body's needs. If you drink excessive alcohol for 20 years, you will make more liver cells to keep up with your drinking. Similarly, if you eat lots of extra carbohydrates for 2 decades, your liver will expand to store that extra sugar. From my experience, patients with the largest livers are not alcoholics. Instead, the biggest livers belong to my patients addicted to carbs. If they are not already diabetics, they will be. They have overstuffed their livers with the age-old habit of constantly eating carbohydrates. They don't allow enough time to empty stored sugars before eating more. Long before diabetics are diagnosed, their livers strain from the pressure of the carbs they eat. They make more and more liver cells to keep up with the carbohydrate onslaught. If they cannot make extra liver cells as fast as they overeat, sugar remains in their bloodstream longer than normal. Insulin will work overtime whipping those glucose into the mitochondria's furnace or into storage. The danger signal of insulin rings constantly. They keep eating, and therefore more sugars enter the bloodstream before the abundant pine needle-like fuel gets burned or stored. The screaming alarm signal of insulin becomes a constant noise. This hormone's danger signal becomes less and less effective as blood sugars steadily rise. Diabetes is defined as a state of constantly elevated blood sugars. Diabetics never empty their storage. Their liver cells are stuffed with glycogen. Their cells have no more room. In an attempt to store their extra sugar, they grow more liver cells. Did you empty your liver last night? Well, let's check. After 12 hours with only water, prick your finger and check your fasting blood sugar. Don't roll your eyes. You must know someone who has diabetes and checks their blood sugar. Borrow their glucose monitor for 1 day. No, they won't die if they don't check their sugar for 1 day. If you burned through all your glycogen and emptied your storage, emptied your liver, your fasting sugar will fall between 55 and 80 milligrams per deciliter. That is a surefire sign you have a normal-sized liver. If your liver has been stretched and stuffed with too many extra carbs in recent years, you won't burn through all that storage in 12 hours. It might take you 20 hours to burn through all those pine needles. Some severely overweight patients take a week to burn through their extra storage. If your blood sugar is greater than 120 at 12 hours of fasting, you have diabetes. No joke, that's the rule of how to diagnose a diabetic. Ideally, your liver should deplete all sugar before you eat another bite of food. especially foods filled with carbs. By the end of phase 2, your body has burned through all your fast-burning fuel. Phase 3, your liver starts making ketones. Time, 24 hours. Status, your fuel is still mostly glucose, but your liver begins making ketones. Only a couple of sections use ketones as fuel inside your body. Brain status, still powered only by glucose. You will know the exact point when you complete phase 2 and enter phase 3. How? You start peeing ketones. Transitioning from phase 2 to phase 3 happens at different times in different people because of the liver's variables described in phase 2. Here are some common statements from patients that tip me off to the possibility that they may have had overstuffed livers. Doctor, I've tried every diet, not one of them worked. Doctor, I am a dude and I look pregnant. Can you fix this? Doc, I had a gastric bypass and lost a bunch of weight, but I gained most of it back. These patients have a biochemistry crisis hidden inside their livers. They have had gastric bypass, gastric banding, or their jaws stapled shut and still were not able to achieve lasting weight loss. They are patients who have used speed pills and antidepressants, participated in group therapy, undergone hypnosis, and injected hormones to lose weight. All share the same results: 0 to minimal weight loss. Alternatively, those that lost some weight gained it all back sooner or later. They were all fighting the hidden monster of the chemistry that blocks against weight loss. The name of that enemy? Insulin. The medical term for these patients is insulin resistance, but I tell them that they have stubborn livers. If you peak ketones by the end of the second day of cutting out carbs, do a little dance. You are not likely to be the owner of a stubborn liver. Keep track of how long it takes you to get to phase 3. This time to first urine ketone predicts the size of your liver. Much like your fasting blood glucose results, this information tells you